morning. I'm Ann Whitman, and I'm a certified peer specialist and peer consultant. And we're here to share our experience supporting community members to be full partners in mental health research. We represent the Center of Excellence in Psychosocial and Systemic Research at Mass General Hospital in Boston. We are committed to improving the health and recovery process of individuals with lived experience of mental health and substance misuse challenges. The center aims to partner with the community in all phases of the research project and process. Our speakers include a diverse team members from our community academic research partnership. And as we go through the talk, team members will introduce themselves. This presentation will provide a brief overview of the community-based participatory research and its applications with persons with lived experience with mental health and substance misuse challenges. And we'll hope to offer some lessons that we learned from our work over the past 2 years.
Hi, my name is Hannah Skeest, and I am a clinical research coordinator. So we know that individuals with lived experience of mental health and substance misuse challenges are vulnerable to both poor health outcomes, which includes early mortality. And this community and population is often not involved as a full partner in mental health research, despite an expressed interest to do so. And when they are included in research, they're often limited in their roles to something like advisory committees, recruitment, or data collection. And some of the reasons that they might not be involved to a greater extent include stigma and historical paternalism, and this has really limited the community's involvement, often due to an assumption of their capacity to understand and fully engage in the research process. So why involve individuals with lived experience in research? Well, they are part of a stakeholder group, and we're defining stakeholders as both individuals or communities with direct interest in project outcomes. So that includes anything from family members to healthcare systems to providers to the individuals in the community. And in research, we often see a gap between research and the actual implementation of that research within communities. And so collaboration with individuals with lived experience in these communities will provide a detailed knowledge of community needs, resources, and expectation, which in turn enhances the likelihood of an intervention's both success and sustainability within that community. And as you can see at the bottom, there's a spectrum of stakeholder involvement, and we'll discuss how we have included individuals with lived experience to be full partners in mental health research. So direct stakeholder involvement can be achieved through community-based participatory research, otherwise known as CBPR. And this method of research really strives for equitable partnership with community members throughout the entire research process. It's a collaborative approach, and it uses both research and data to build on the strengths and priorities of the community for multi-level strategies to improve health and social equity. And we see increasingly in the field that CBPR is seen as a valuable framework for research for facilitating mental health research partnerships between academic researchers and community members that have been historically marginalized or are feeling distrustful of healthcare systems. So with these strengths-based principles that promote sharing power, commitment, mutual learning, cultural humility, and capacity building among all partners, CBPR really has the potential to successfully guide research initiatives that really fully engage community members.
My name's Diana Arntz, and I'm a clinical psychologist and research fellow at the center. So in order to provide a foundation for a CBPR partnership with persons with lived experience, there are essential organizational elements needed. So for example, it's really important to have institutional leadership buy-in for starting and maintaining any CBPR work, as CBPR has different timeline, processes, and milestones compared to traditional research. So for example, you want to have your leadership supporting you as a research team, taking ample time and resources necessary for stakeholder outreach and engagement to build up trust with the community and determine priorities and fit for partnership. So compared with traditional research that may send out a survey or conduct work on the community and then leave, we are really looking to establish an ongoing relationship and do work with the community. So leadership must see the value and benefit of stakeholder engaged research in order to ensure the success and sustainability of your work. Another area to note, due to historical oppression and devaluation, we recommend any partnership with persons with lived experience to include equitable compensation. Peer consultants at our center are paid an hourly rate of $50 and have flexibility determining their hours and workload. This decision was informed by our community partners' feedback and aims to uplift persons with lived experience to want to engage in partnerships, feel valued in their work, and become successful researchers themselves. So there are important interpersonal and team processes needed for sustaining CBPR partnership that are even more salient for working with persons with lived experience. These include trust, transparency, open dialogue, humility, flexibility, open communication and collaboration, problem solving, sharing power and embracing diversity of lived experience, social cultural identities, perspectives on wellness and success, thoughtful team building and celebration of successes, self-reflection and ongoing evaluation of team projects and group process, and fostering co-learning about each other's expertise, CBPR principles, and the application of research to best address community needs. So these are really required by both parties, and we all must expect to take considerable time to foster these skills together and through outside consultation and ongoing training.
So we hired 6 peer consultants and a senior peer consultant, and they were all motivated by social justice. They had multicultural and bilingual backgrounds, very broad connections to recovery communities across Massachusetts, which was incredibly helpful. And they all had expertise in peer support and recovery.
Peer consultants spearheaded a community needs assessment. This is the early phase of community-based participatory research that is really essential. It's essential to shaping future research questions and initiatives that are of importance to the community. We were able to design and implement listening groups with the goal of establishing trust and identifying current priorities and needs in the recovery communities across the state of Massachusetts. The community needs assessment included 159 participants at 8 community sites. The PCs partnered with research staff in coding session transcripts, report writing, and sharing findings widely back to the community and other stakeholder groups.
Hi, my name is Jacqueline Martinez, and I am a peer consultant and a certified peer specialist, also a certified medical interpreter, specializing in mental health interpretation. So the findings from the listening groups coupled with the CBPR team members' interest has guided the development of peer-led pilot research studies and quality improvement projects aimed at improving systems of care and enhancing overall wellness for recovery communities. One example of these peer-led projects that we are so proud of is the production and design of our Parents in Recovery video. We had one pilot group at a Boston area Department of Mental Health shelter. We have included the link to this video at the end of the presentation and encourage you to watch it. We want to share the lessons learned from this partnership. That is 2 years in the making. There are benefits and challenges to both peer consultants and research staff shared in this partnership.
So one of the first benefits was relationship and team building. We had a very entrepreneurial culture at first that encouraged peer leadership and peer initiative. And this built the foundation for trust with the academic researchers and spurred a lot of creativity, innovation, and growth, which made our processes very meaningful. And Valeria will talk about that now.
Thank you, Anne. Yes, I'm Valeria Chambers. I'm a certified peer specialist. We definitely learned that it takes a village. We found that by working together with our team while getting input from our community partners, steering committee, and other stakeholders, we were able to begin to create projects both relevant and helpful to all, and also in line with our mission and vision as an organization.
Mentoring and new transferable skill sets. What a powerful team. During COVID-19, we went virtual easily. We made the transition as a team was already trained in technology and Zoom. Tons of trainings, for example, digital peer support, anti-racism trainings and dialogues, skill building, research methods, digital peer support, technology, just like this presentation, and preparing for it. How to have a difficult conversation and make it safe to do so.
Definitely key was establishing and reinforcing community conversations. We realized that community input is key and must take the lead. By staying engaged in listening and learning from our community partners as well as from each other, we were able to design projects that are reflective of the community's needs and values.
We did have some challenges, and one of the first ones was organizational structure, communication, and decision making. We had, as I said, a very open-ended, fluid, entrepreneurial culture. But challenges came with this, and peer consultants and staff members were concerned about ambiguity, roles and expectations, the clarity of the decision-making process. And so we're now developing work plans for each one of the peer consultants that outlines what they'll do during the year, but maintains a lot of creativity, choice, and flexibility.
Perhaps not surprisingly, invoices and budgeting were a challenge. We learned that patience is definitely a virtue. It's taken us some time to learn and modify as needed, all the complex details required in managing the time and responsibilities required for each project, while also recording them in such a way as to be easily accessible for budgeting and payments.
Okay, so we'll be identifying realistic and manageable work capacities. What we have learned so much during these past 2 years. Now it's time for a new plan. So our schedules and availability changes on a monthly basis, balancing those multiple tasks and roles and from our outside jobs and family responsibilities. Recovery and working on wellness flexibility is so important. Focus on self-care and provide reasonable accommodations and communicate with one another. There is no stigma that can't be handled, that can't handle this work, even if we're balancing self-care.
We also had some difficulty navigating different work styles, needs, and priorities. The entrepreneurial, make it happen culture of the peer consultants clashed a little bit with the slow, structured style of the academic research center. So we're working now on a hybrid model, which means putting some structure in place while maintaining the sense of relevancy, urgency, creativity, and innovation that the peer consultants desire.
We wanted to leave the audience members with some questions to consider if you are thinking about CBPR, if you're starting this work. So questions include, why might I want to be involved in CBPR? What are the potential benefits for fully partnering with persons with lived experience? Some potential challenges or ethical considerations. What assumptions do I have in partnering with persons with lived experience? And for communities members, what assumptions might I have with partnering with academic researchers or clinicians conducting research? What organizational elements do I need in place to establish a CBPR partnership? And what interpersonal and team processes do I want to foster to sustain that partnership? And lastly, am I really ready right now to fully commit to a long-term CBPR relationship? So we want to thank you for joining our talk today. Just wanted to also highlight again that we are funded through Massachusetts Department of Mental Health grants. We're so incredibly lucky to have a wonderful team, and sadly not everyone's able to join our talk today, but we listed the group here to acknowledge that this is truly a team effort. I've also added the link to our peer-led Parents in Recovery parenting video, and I encourage you all to take a look at that. And those thinking about or currently doing CBPR partnerships with community members, particularly with persons with lived experience with mental health or substance misuse challenges, we strongly encourage you to please reach out to us. We left our email as well as our website. I think it's really important for all of us doing this work to share our knowledge with one another, to offer support and consultation, and really to uplift each other, because this is really important work, but very hard work. So thank you all.